starting.
Come in.
Good afternoon, Mr. David.
Good afternoon.
My name is Royale, and I am a student nurse from South College.
Okay.
Today, the doctor has ordered that I do your attitude assessment.
Okay.
Could you please tell me your name?
My name is David Johnson.
David Johnson. Can I see your wristband? Tell me your date of birth, please.
January 12, 1984.
Thank you, and I provide privacy. The door is closed.
Okay.
All right, I'll go ahead and wash my hands. Can you tell me what today's date is?
Today is December 4, 2019.
Very good. And do you know where you are right now?
South College, Atlanta.
Good. And who is the president of the United States?
Oh, Donald J. Trump.
All right. Thank you. And right now I'm just looking at you head to toe. You're well groomed. You're dressed for the weather appropriately. Hygiene is clean, is good. So I'm gonna be coming closer to you, and I'll be touching, some part of your body.
Okay.
So if you feel any tenderness or pain, just let me know, okay?
Okay.
And we can go ahead and address that, okay?
Okay.
All right. So I already checked the vital signs of my patient. His blood pressure is 120/84. Pulse is 82. Respiration 16. Height is 5'5". Weight is 182, and the BMI is 21. All right. So I'm looking at the face, just touching your skin. Is warm to touch, is dry, no lesion noted. All right, very good. I'm going to run my fingers through your hair. Head is normal cephalic, no lesions noted. Hair is evenly distributed. All right, very good. All right, I'm going to have you clench your eyes for me, please. Very good. Now clench your teeth. Very good. All right, I will be pulling down your eyelids.
Okay.
All right. The sclera is white, conjunctiva is pink and moist, no exudates noted. Very good. I will be shining a light to your eyes. Just look straight at me. All right. Very good. Very good. Let's see. All right. So the pupil is equal reactive to light and accommodation. So that's very good. All right. I will be I'll be checking your sinuses. Do you feel any pain?
No.
No? All right. Any pain?
No.
All right. So the frontal and mandibular sinuses is non-tender. All right. Next thing I want to do right now is to go ahead and check your hair. Looking at the hairs on both sides. Do you feel any pain, any tenderness?
No.
No?
Mm-hmm.
Good. The pinna of the hair is slightly above the eye level, so that's good. I'm gonna assess your hairs. I'm looking at the outer hair right now. No skin lesion, warm to touch, and it's dry. All right. Let's see. I'm looking at the inner hair. No exudates noted. The hair canal is pearly gray, which is very good. I'll be checking the other side as well. And I'm pulling the hair back and up and back. The hair canal is pearly gray as well. All right. And I'm just palpating the hairs again. Any pain noted? Any
No.
pain? No.
No.
Okay. Great. No pain noted. All right. I'm going to you follow my finger.
Okay.
Just look straight towards me. Don't turn your head. Just use your eyes
Mm-hmm.
to follow my finger, the direction my finger is going. Okay?
Okay.
Are you ready?
Yeah, I'm ready.
All right. Very good. Excellent. Okay. Now, you're gonna see my finger wiggling around. When you see it, let me know when you see it, okay?
Okay. Yeah.
Okay?
Yeah.
Okay?
Yes. See it. See it.
Okay?
See it.
All right, very good. All right. Okay, so let's see. I'm gonna touch you with is a light sensation. Just tell me when you feel if you feel anything, okay?
Yeah. Feel it.
Feel it?
Mhm.
Okay.
Yeah.
Feel it?
Mhm. You feel it.
Feel it?
Yes.
Good. Feel anything?
Yes. You got it.
All right.
Feel it.
All right, awesome, great. All right, the next thing I like to do is go ahead and examine your nose. If you tilt your head back a little bit for me, and I'm just shining my light through. Nasal, no drainage. Hair is evenly distributed. No deviated septum noted. Septum is midline. And I'm also looking at the nose. The nose is symmetrical to the face and is midline. All right, great. I need you to open your mouth for me, please. And I'm looking at the mouth. The uvula is midline. Soft palate is I really can't see the back of your throat very well. All right, I'm going to use this to depress your tongue a little bit, okay? All right, very good. Buccal mucosa is pink and moist. Teeth is evenly spaced and distributed. Uvula is midline. The soft palate is pink and smooth. And I'm also checking the gum. The gum is pink and moist. No lesion noted. Very good. A tooth is missing in front here. All right. Very good. I need you to stick your tongue out for me. Move it left and right. Very good. Up and down. Okay. Very good. So the lips is also moist, pink and moist. I'm gonna say like there's a little dark discoloration, but it's because of your skin tone. So that's still normal. Okay. All right. So so far I'm gonna check there's a scent, a smell on this. I need you to tell me what you perceive.
Banana.
How about on this side?
Orange.
Okay, great. So cranial nerve 1, 2, 3, 4. Cranial nerve 1, 2, 3, 4, 6, 7, 10, and 12 are intact. All right, great. So the next thing I'll be doing is I'm going to check your TMJ. I'm going to check. I'm looking at the jugular vein right now. Okay. I don't see any distension on both sides. No edema. Skin is warm to touch. No lesions noted. I'm going to palpate the carotid pulse over here. Very good. Very good. Carotid pulse is regular plus 2. Regular reading plus pulse is plus 2 on both sides, bilaterally. All right. I like to listen to on the carotid artery, and I'm using the bell side of my stethoscope. Listen on this side too. All right. No bruits noted bilaterally on the carotid artery. All right. Raise your neck up for me, and I'm looking at the trachea. The trachea is midline. I'm gonna palpate. Do you feel any pain or tenderness?
No.
No. All right, now go ahead and swallow for me, please. Very good. I'm gonna shrug your shoulder. Try to shrug your shoulder for me. Okay, very good. Cranial nerve 11 is intact. The next thing I'll be doing right now is to, since I started with the carotid artery, I'm gonna check other, you know what? No. Let me erase that part. Okay, I'll go ahead and listen to your breath sounds, okay?
Alright, thank you.
I just need you to breathe normally for me, please,
Oh,
okay?
okay.
And relax. Alright, very good. Bronchial sound heard over the trachea. Bronchial vesicular sound heard over the bronchial, and vesicular sound heard over the remaining field lungs. Field lungs. Fields of the lungs. I apologize. Alright, great. I'm gonna listen to your breath sounds on the back as well, okay?
Okay.
So I'm gonna need you to take a deep breath for me, please. Can you sit up properly?
Sure.
Very good. Take a deep breath. Out. In. Out, please. In. In and out. Out. Very good. In and out. All right, very good. Still sitting straight in the upright position. I need you to say 99.
99, 99, 99, 99.
Very good. All right, bright sounds are clear on the posterior side, and I also assess the skin on the back. It is warm to touch. No lesion, no drainage, no laceration or anything, and there's no scar on the back. All right, I'm going to listen to your lung sound. If you don't mind, can you lay back down for me, please? And I'll just stretch this out so you'll be more comfortable. All right. So I'm standing on the right side. I will be listening to the, I'm going to start out from the aortic, which is between which is found on the right intercostal space. And right now I'm listening to the pulmonic on the left, on the second intercostal space to the left. I'm moving towards the Erb's point, which is between the second and third intercostal space. And I'm moving my way to the tricuspid point, which is between the third and fourth intercostal space. And I'm moving my hand to the between the mitral valve is located in the fourth and fifth intercostal space. All right, very good. S2 sound is louder than S1 during auscultation of the heart, and no murmurs noted. Very good. Okay. And I'm also assessing the skin area of the chest. No lesion. Skin is intact and is warm to touch. All right. I'm going to lift pull your clothes back a little bit.
Okay.
All right. Just to expose you right here, just a little bit, okay?
Okay.
All right. I am looking at the skin of the abdominal area. It is intact. No pulsation noted. Umbilical cord is midline to the stomach. So the first thing I want to do is go ahead and listen to the breath sounds to make sure that I'm not disrupting anything. And I will be listening to the breath sounds in each quadrant for 5 minutes over the 4 quadrants. And I'm starting from the below the diaphragm right here. Very good. Hyperactive bowel sounds noted on all 4 quadrants. The next thing I want to do is to go ahead and palpate the abdomen. I will be palpating your abdomen. If you feel any pain, just let me know, or
Okay.
any tenderness, okay?
Alright.
Okay. Any pain?
No.
Any tenderness?
No.
No? Okay. Alright, very good. I'll go ahead and percurse. Alright, very good. No presence of ascites noted. Alright, go ahead and sit up for me, please. I'll push this back. And while I was examining the lungs earlier, I noticed that this downward slope of the rib cage is at a 90-degree angle. Breathing is unlabored and it is even on both or bilaterally. So that's good. And lung sounds was clear when on assessment. Okay. I will be checking for the pulses bilaterally. You turn your hand this way for me, and I'm assessing the brachial pulses. It is regular bilaterally, and it's +2. Radial, regular, bilaterally +2. Can you scoot forward, please? I'm assessing the proctile. It is regular bilaterally +2 pulse noted. This is the posterior tibia. You mind taking your shoes off for me, please?
Sure. I got it.
Okay.
I'm on your business.
Very good. Thank you. Just gonna roll your sleeve up here real quick. All right. All right. The posterior tibial pulses are regular and +2 pulses noted. This is the dorsalis pedis pulse. It is even on both sides and it is regular, +2. All right. Okay. I'm going to be assessing for muscle strength. So I need you to turn your leg this way. Turn it around that way. Very good. Up and down. Very good. I'll push against your face. Try to resist me. Very good. Go this other side. Resist me. I'll try from the back. Very good. Very good. All right. Now I need you to hold your hand out this way. I'll push against you. Try to resist me. Very good. Very good. All right. We're going to do the legs as well. Okay. Very good. So muscle strength is 5 over 5. All right. I'll hold your hand out this way. If you let this, let your, just relax your arm on my hand. Let it dangle. Relax. Okay, very good. Let's try this one too. Relax as much as you can. Relax, relax, relax. Very good. Also good. Take that on your feet. Let your legs dangle. Let it dangle. Just relax it. Relax as much as you can. Let's go forward. There you go. Very good. Very good. All right. I need you to put your feet together. Turn your feet out. All right, great. Bring it back in. Rotate your ankle. Very good. Now put your feet downward, upward. Very good. All right, so for the purpose of this video, I'm unable to access the anus, but I'm just going to verbalize, my result. Anus is intact. No lesion noted, no hemorrhoid noted as well, no tenderness. All right, and I also palpated the femoral pulses. The +2 pulse was noted, and reading is normal reading on both sides, bilaterally. All right, Mr. David, are you okay so far?
I'm all right.
All right, so if you please stand up, let me push this up. Safety first. All right, if you stand right here by the window for me, there is a chart on the wall. And on that chart, you're standing 20 feet. Back up a little bit, sorry. Thank you. So I need you to read the line you can see on the chart clearly without straining your eyes. If you focus on the line and you cannot see it, move up to the next line, okay?
FELOPZD.
Very good. So basically, Mr. David can see from at a 20/25 as a 20/25 vision. All right. Very good. Mr. David, I need you to walk on your toes towards me, please. Very good. All right. I need you to walk on your heel backwards. You're doing good. Very good. Great. Gait is intact. All right. I'm going to have you touch your toes. Very good. And I'm looking at the spine. The spine is straight. No deviation noted, and the skin on the back is intact as well. Very good. All right. So the next thing I want you to do is close your eyes. Close both eyes. Put your hands by your side, feet together. All right. Very good. Now raise your right leg up. Very good. Now raise your left leg up. Very good. You can open your eyes. Romberg sign is negative. All right. Go ahead and have a sit back. We're going to test range of motion for both for lower extremities. All right, go ahead and lay back. Move your leg out. Back in. The left leg too. Back in. Raise both legs up and down. All right, and can you bend your knees for me, please? Very good. All right, sit up, please. All right, hands out, in, up, and down. All right, very good. Range of motion is active range of motion is noted both upper and lower extremities. Assessing the hand, the skin, everything looks good, intact, no lesion, no clubbing on the fingers, and capillary refill on both hands, less than 3 seconds. I'm also looking at the legs, no varicose veins noted, capillary refills less than 3 seconds, no clubbing. And that completes the end of my video.